Welcome everyone, I'm Tom Ryan with Provider Outreach and Education. I'll be your presenter today for the webinar Medicare Air Ambulance Requirements. I'm joined today by Leanne from my team. She's going to help with the chat portion. She's going to ask me questions and answer questions. If she has additional information, she will go ahead and provide that. A little bit of housekeeping about today's webinar and things you want to know. First, if you do want to download the training material, which is actually just this PowerPoint that I'm displaying right now, I do recommend that you take time to do that right now. You can go to our Training Center webpage and then go to the live event page. On this page, you can register for an event, but you can also download this material. Super important to make sure you have that. Again, totally up to you. Also, want to let you know that we will be recording this, and I think I just told you all it's being recorded. The purpose of this recording is that we can then post it into our Encore presentations page. We expect it to be out for 60 to 90 days, at which time you're also able to download the material. It's the exact same PowerPoint, so if you download it for the live event, you don't need to re-download it again for the Encore presentation. But if someone else wants to watch it, they do also have that. For today's live event, any questions can be submitted in chat. I will work my way through those questions as well as all the pre-submitted questions. Anything left unanswered at the end, we will email you a response. The very last thing I'd like to talk about in terms of housekeeping is please make sure you take our survey. You probably take a lot of surveys, but we want to remind you that at the end, we're going to offer you a survey. You can grade the presentation, you can grade overall how we're doing as a MAC, but you also get to grade me as a speaker. CMS does look at these results and they do see how we're doing. I also look at them to see what I could do better. So the survey will be given to you again at the end, and it's really important that you take it. A couple of key things to keep in mind with Medicare. This presentation is designed based on today's rules, laws, regulations, all that fun stuff. However, Medicare can change and has changed in the past. So I want to make sure that everyone is aware of that. So with that said, I did verify as much of the information was still current this morning. There's always going to be something that could potentially change. That current information is on the CMS website. We will be given answers based on what is current today. If you're listening to this in the future in an Encore presentation style and something has changed, it's your responsibility to check and find if that information has changed. We obviously wouldn't know that in the current information. We also do ask that you do not record, screenshot, or do any other type of thing with this presentation. Again, WPS will do that, and we will post it to our Encore presentation YouTube channel. We will also then post it on a link to it on the Encore presentations page on our website. So if you're recording, we ask that you please stop and you will use the recorded version that we have. The reason for that is CMS does not want you to record and use it for any profit-making purposes, and because we don't know how you will use it, we also then ask that you just don't record it as an overall basis. All right, so what are we looking at today? Well, today we want to look at the Medicare denials and again to understand the air ambulance requirements. Now we're just trying to avoid the basic denials, and the denials are pretty basic when it comes to air ambulance. The number one denial is obviously no documentation. We didn't even get a response back, so that's obviously not really going to be helpful in terms of educating you other than to respond to medical records. The next one is it's not medically necessary, and we'll talk more about that because that's broken into two separate components. One, the transport isn't medically necessary, or two, it's not medically necessary at the level that it was provided, which means that ground could be been a safer option or a different option that also would have been payable. So we will look at the overall ambulance requirements. Now, the overall ambulance requirements are for ground and air, but they are what is required for all transports. Then we're going to move into specific air requirements, because while ground has certain things that are required, so does air. Air has more specific requirements, and some of those is basic proof of why air is needed. Last, we will finalize the question and answer section. So first thing is just the general requirements. As I said, these are all transport requirements, though they are applicable to air, and you must meet your basic requirements. If you fail to meet the basic requirements, we don't look further into the medical necessity portion because there is no reason to do that. So that's one question that was asked, is if we don't meet the basic requirements, if we don't meet the basic ambulance information, does Medicare look at the medical necessity portion? And the answer is no, we don't do that. So I want everyone to be aware of that when we start these requirements, which is why we're going to talk about them. The number one thing that we actually have a problem with is the lack of documentation. It's either not sent back or it doesn't support the medical necessity for the service. So please take a look at our ambulance documentation requirements. This is to help you understand what the documentation is, what is needed, and why we need it. So it's a complete as quickly as possible after. That's going to be a tip. When you're looking at these documentation requirements, you want to make sure that the information is still fresh in that person's head, whether it's an EMT, a registered nurse, a respiratory therapist, whoever happens to be on board and is treating that patient today. We want to make sure that it gets done as quickly as possible after. That way it keeps it as fresh as possible. If possible, during the actual air transport, you want to document as much as you can. Now, some people say, hey, we were able to do the chart and just say, hey, this is when this happened, or this is the service that we did at this time. And that's fine, but then complete the documentation, which could include a narrative as soon as possible afterwards. It is the requirement that from Medicare that the EMT or the person treating the patient, so it could be an air ambulance staff, again, it could be someone boarding with the EMT, or it could be possibly like a registered nurse or someone that is part of that air ambulance crew, explains why it is medically necessary for this air transport to occur. Why is this the safest possible means to get the patient there? Why couldn't they have gone by ground? And that's some of the really basic requirements that we look for. Now, that requirement is actually based in the Social Security Act, and it's a two-part section. So we'll talk a little bit more about medical necessity and how that works. One of the other ones that is interesting is that on occasion we do have signatures that are missed. Now, the signature isn't just the person treating the patient, the EMT treating the patient. It could be the leaving facility, what was given, what was said, or the receiving facility for the transfer of care. It could be any of those. One of the other ones that we tend to see a lot of missed is the patient signature. They'll send in all the records with all the proper professional signatures, but they don't have the patient signature to file, in which case Medicare would say you shouldn't have filed a claim. Now, that doesn't mean it's not within your record. It just means you didn't send in that piece of paper that says, hey, you have the right to do it, or you didn't print the proper page in the electronic medical record to incorporate that. So basic documentation requirements. It was asked for information in the article, so let's take a look at that. Where to find the article, I think it may help you a little bit. Let me just pop my website up here. This is the WPS Government Services, and I think the person that was asking this, they obviously knew of the article by the question, but they didn't know where it went, and that was kind of the key that I got out of there. And if I am misinterpreting what you're asking me, please put that back in chat. What happened is it's still in the topic center. This article used to be in claims. It is now in the documentation section. Okay, so topic center, and we have moved it. We moved it to documentation. When you come into the documentation, you can search however you choose to search here. I'm just going to filter, and I'm just going to filter for ambulance. And then you can see I do have a couple of different things going on there, but I'm going to use the documentation one because that's what we're talking about today. We just open claim submission. This I'll talk about terminated. And again, I didn't type the full word ambulance, so it gave me ambulatory surgery center, or are you a professional ordering ambulance? Really the one we want to look at is this ambulance documentation article. And it's just going to walk you through all of the basics and also talk about some of the different things that are precautionary tales, I guess, for lack of a better word, and things you want to make sure you're adding more information on. So if you're looking for that, please remember that it did change locations. It is a new, not new, but a newer one. Documentation is what you're looking for here. Just like benefits and eligibility does have some information as well on ambulance. So hopefully that answers the question as to where that went. It didn't actually, get removed from the website by any means. It did, however, get changed locations. Let's go through some of those basic things that have to be met, and let's talk about why. So the first one is obviously medical necessity. Now, we say everything in Medicare has to be medically necessary, but what does that mean for ambulance, and why is it so important? Well, for any type of ambulance, whether it's air or ground, the transport has to be based in medical necessity, and it has to be the only safe means of transport. In other words, whether it's air or ground, they have to be taken by ambulance or the patient's health would be at risk. This is actually from the Social Security Act, and it's section 1861S7. I did give you a direct link to 1861 on here. The reason that we did put that information on there in such an interesting manner is because a lot of people will say, well, 1862A1A, which is a different section of the Social Security Act, states that the services must be provided at a medically necessary level of care. That doesn't change for ambulance. So 1861 says, first and foremost, it has to be medically necessary. Otherwise, Medicare can't even consider the charge, which means that you would bill it as a not covered service. So if the transport's not needed and you could do it with any other method, regardless of whether or not that method is available, that's a section 1861 issue, because they could safely have gone by a different means. Okay? Sometimes we actually have had doctors send in physician certification statements stating that they're moving this patient to a further facility, and it's actually going to be by air. And the reason for the move was because the patient keeps medically discharging themselves against advice, and they don't want them to be able to do that. Well, that doesn't make the ambulance transport medically necessary, especially if the facility could treat them. So there's a variety of things that factor into all of those different things, and especially at the air level. So that's one of the interesting scenarios that came up in particular with air ambulance and the medical necessity portion. Okay, I do want to let you know that yes, the emergency medical technician or the person assessing the patient who's going to treat them on board. So this could be, again, a respiratory therapist, an RN. It just depends on who's on board the air ambulance that day. They do need to assess the patient. They are the ones that do establish medical necessity. They do that. They can use a physician certification statement to help support them in establishing medical necessity. What it doesn't do is alone establish the medical necessity. The only way to establish medical necessity is through the assessment of the treating person on the transport. Now, we say they can use it to support because if they're given certain pieces of information, understanding, etc., then that's important to make sure that they have that and that that's what they're evaluating. This is what whoever's sending them by air thinks is important. This is what you need to know, and we want to make sure you have that information as well. All right. From medical necessity, it is broken into a variety of factors. And obviously the first one is active treatment. And this is straight out, you are doing something to make this patient stay alive. This is your active treatment. So yes, you need to tell us what are you doing to keep this patient stable? Why are you the only safe means of transport? What's going on with this condition today that means that you're actively treating them? This is honestly the one where we have the least number of denials with it, because people understand what active treatment is. They don't have questions on it. There isn't a lot of confusion over the active treatment portion. They also understand sometimes that they're not doing active treatment, and that's where some of the other ones come in that we're going to talk about in the next couple of slides. Please remember, we always want to identify why it's life-threatening without your intervention or treatment, which means what medical skills are required. What were you trained to do when you were on that air ambulance that makes it medically necessary? It definitely could be that you're taking a respiratory therapist for a person who has smoke inhalation. Sure, that makes sense, right? What about for someone who is needing certain levels of care and your air ambulance has an RN on board all of the time? That's fine. Just have them tell us, why are they needed? What's going on with that air ambulance today that makes it needed? Also, please list any drugs, method of administration, anything given like that. Though the drugs alone don't necessarily prove that an air ambulance was required, it does help sometimes understand for stabilization or other key factors as to the treatment and what's going on. We have had some different methods where you've listed the drug, and in the medical record, we don't know how it was administered. So it's a drug that could be administered orally. It's a drug that could be given through a shot or could be given through an IV. And we're trying to figure out exactly how that was given. Well, without that complete picture, we don't necessarily understand why you're needed. Now, I chose those three items because they're some of the key items that either are missed or are not highlighted enough or not explained well enough. But I want to let you know it's not an all-inclusive list. This is definitely not everything that you want to look at. Okay. So if you have questions or you'd like more information on any of those or even additional items, please feel free to throw that into the chat and we'll get that for you in just a few moments. All right, next, somebody did ask us a very specific question. What if it's only monitoring? So they're in air ambulance only for monitoring. Well, that is something that Medicare can consider, but we do need to know, what is the EMT required to monitor? What is the person actively monitoring and why? And please don't put words like oxygen or um, levels of something. Well, what does that mean to us? There are people that walk around all the time on oxygen. They monitor their own oxygen. They have compressors. They have different things. So when we're looking at monitoring, make sure it really incorporates it. Are there complications that make time a factor? So while you're monitoring them, they also have this complication going on. And if we take this long on the air crew to get them there, this is what's wrong. Where if we leave the facility, even though it's going to take longer, that monitoring can occur. This makes it medically necessary to use an air because we don't want them out of the facility. All of that is information that can come with your record. In other words, it could be a discharging facilities information. Also, things that people have put in for monitoring. We're monitoring this patient because they were in the middle of the woods and we're the only safe transport to get them out of the woods and to. That one actually came from the UP of Michigan. Well, that makes sense. It's part of the transport requirement was to get them there, but you couldn't get a ground ambulance transport to them because of their physical location. But they were able to land a helicopter. And so therefore part of it was the monitoring all of the stuff that went into that. There's nothing wrong with that type of monitoring. It just needs to be explained very well. Please do not do an automatic assumption just because they're oxygen or bedridden. We had someone write, the patient lived on a farm, and in order to get to them, it was done via, again, helicopter, rotary wing. And this was due to where the farm was located and a variety of other things, like the fact that there was no bridge leading to the farm, it had washed out. And so they needed to actually get to the patient. So this is the scenario. The patient is bedridden, and we took an air ambulance to get to them. Okay, well, that's great, but can you explain a bit more of why they're bedridden? Are they able to stand with help and assistance? Could you have taken something like a boat across and gotten them out that way with an EMT? Because we will pay for water ambulance as well. I don't know the situation. I don't know what is the safest method. I can't answer those questions. I'm just saying, in this scenario given, could you give me some more information to really help me understand and to really make sure that it's medically necessary for the air? I'm absolutely not saying it wasn't. I'm saying I just don't have the information in that case. The next one that has come up a few different times, and there was a couple of questions about it, was mental health. I wasn't really sure what mental health transports were being performed. So I put this slide in as kind of a general slide, I guess, for lack of a better word, because Medicare does cover mental health transports, but what we have to look for is the medical need or immediate potential for self-harm or harm to others. And remember, when it becomes medical need, that's not a mental health transport anymore. And in the example that was given, it was an actual suicide attempt, and they were starting a fire where they were going to burn the house down with themselves in it. And I don't know if there was more people. I don't know, other than that it was a suicide attempt and this is how they were going to do it. What they actually did was spill gas on their clothing. And so they wound up with burns over a much more severe part of their body. So while the fire was put out and there was no like house fire in terms of death like that, they did have substantial burns and needed a burn unit. That's not medically need due to mental health. That's medical need due to medical circumstances. So mental health alone, while it was a contributing factor during that transport, and it definitely could contribute to the fact that they're trying to pull out IVs or why they need to be strapped to something or what's going on with this patient, it alone didn't make this transport medically necessary, nor did it make the air portion medically necessary. In this scenario given, the person needed to be stabilized and was stabilized at an ER, but that hospital did not have the ability to continue to care for them. They billed it saying it was a mental health. When we really read into the record, the transport was for the burn stuff, and they needed to be moved to a burn center amongst other things because there were some respiratory issues and other that they needed. So the higher level of transport, air being the key here, was not due to the mental health. It was due to the medical necessity. So I'm not really sure what you were looking for in terms of the mental health in that scenario, but I will tell you that when we look at mental health, one, we need to know what is the immediate potential harm to them or to another. If we could take them by, a car, if the police could take them in the back of their car, however that situation is, that will make it not medically necessary. So if you have more on the mental health scenario that I just gave you, or some more different information that you think I should consider or didn't talk about there, please put that back in so that I can get that information to you in just a little bit. So I just thought I would share that with you, and that was the scenario given for the mental health one, which again didn't really wind up being truly mental health. More information. We always will ask for you to add more information in the following. When the patient is bedridden, tell us what that means. Tell us why the air is needed. Why, even though they were bedridden and they couldn't get up, could they not sit in a chair and be moved that way? What made the medical necessity for the air? It's very hard with this one when they're just bedridden, and that's what we're looking at alone. Now, again, if they're having complications, if they have additional things like ulcers and wounds and things like that, maybe bleeding issues, there are different things that can definitely play into that. Oxygen dependence. We put this one in there because a lot of people live with oxygen often. It's not an uncommon thing. They walk around with their condensers, they walk around with their little, their oxygen tanks, and then they're doing this on their own. So why is it that they're on oxygen? Why is it that that is what makes this a medically necessary transport? If they monitor on their own on a regular basis, why do they need the EMT or the nurse or whoever, the respiratory therapist? Why do they need them? And even more, why do they need to go by air? Now, we're not saying that that does not make it medically necessary. What we're saying is add more information. Isolation transports are another one that we've had a few different issues with, especially in review during COVID-19 and other things like that. Now, some of the isolation transports were, factored in for various reasons. But remember that if they came by car and they're going within a distance of that car, why couldn't they go with that? What is the condition that's requiring this level of air? That was the question being asked. Now, again, not always is that going to be necessary. Not always is that going to be a full explanation, but you need it to at least have statements. Why was the ground isolation not an option? If you can clearly indicate why that wasn't an option, that will also help us understand the other one, which is why is the air required? What will the air crew be doing during the transport that was beyond monitoring for isolation? What's happening that makes this medically necessary for an isolation? And then why is there a time factor? What is the time factor? Maybe there's a condition that the patient needs to be treated, and so they're doing all of these different items to make it, less of a factor. I don't know that, but tell us if you can. Contagious. This was one of my favorite ones from the air information that I was looking at. They're like, we transported them because they were contagious. Okay, we're not arguing that they were contagious. This person came in, was transported to an ER. During that transport, they were driven in by someone else, which means that person has already been exposed. So they were contagious, but the person's already exposed. They then exposed, the people in the ER, etc. Now we're going to expose an ambulance crew. But the truth was they could sit on their own. They could do all these things on their own. We're not saying they shouldn't have gone to a different facility. We don't know that. We don't know the full scenario that was going on based on the documentation that was given. Our question was, what did the EMT, what did the staff do that needed to move them for that contagious condition that someone who'd already been exposed to it that had brought them in could not have done in the car? What was the difference there, and what was really needed? Now, the reason this one also came into the air factor was because there was a portion after being moved from one ER to a hospital. The second hospital then sent them by air to another hospital, but still using the word contagious as the primary diagnosis. Very little explained about it. When you finally sent in the supporting documentation from the first hospital, the one where they were transferred from, there was a bit more information. It really did help us understand. Here's what was clear. The air transport team did not have all of that information. Their records did not indicate that, and they did not indicate that they had had a full briefing, and that became problematic as well. So trying to use the different scenarios for what we've seen, we wanted to make sure that was given. All right, let's move on just for a second and talk about one of the other basic requirements. This one is pretty well met. It's just sometimes people have questions on it, and one of the questions that did come in was regarding um, S. So we're talking about the origin and destination and the modifier, which goes with the base rate code or the mileage code, and it's really just to tell us where they started and where they ended. The reason that the person was asking about the S in particular is they were using the S for a site between methods of transport, which is really an I, but they said should it be an H because they're leaving the hospital, being driven to their fixed wing at an airport, and then going back to a hospital, or they're being leaving the scene of an accident and being driven to a site of transfer between methods, which again could be a fixed wing, it just depends. Could also be a rotary wing. Um, So yes, S can be appropriate, but it's not typically going to be anything used by a fixed wing airplane. Now, a rotary, absolutely. You could fly that helicopter in, land it fairly close, and you're going to pick them up and you're going to take them directly from that on scene and you're going to fly away. That is correct. That is the correct use of an S. So I wasn't sure which one they were referencing there. The hospital. The only time a hospital is used is when they have a rotary wing, or in other words, helicopter landing pad on site, and you are literally transferring them from the hospital, from that building. Otherwise, it's not appropriate. Site of transfer is an airport or another location that is considered a separate independent thing. A lot of times you'll actually have 3 transports for one fixed wing. Why? You have 2 ground transports, which would be the to and from, and then the final is the air, which is site of transfer to site of transfer, because you're going air ambulance, fixed wing from airport to airport. So it really just depends. These are the commonly recognized ones regarding air. And they had asked, in particular, the question asks, can you use S for scene of an accident or acute event? My answer to you again goes back to what type of air transport are you providing and whether or not that is the correct one. Okay. That's the only thing I have to offer for you. Yes, S can be used. However, no, S cannot be used as a destination typically for air. Why are you taking them to the scene of an accident or acute event? That doesn't make sense. So we want to make sure it's in the origin position, followed by an H as a destination or an I as a destination. And I put that in there again just to answer that question. I thought it was interesting. Also, I did give you the full list of references, so hopefully that will help you to give you all of the different origin and destination codes. All right, what's next? There was a couple of different questions about whether or not Medicare follows the secondary payer rules. And the answer is we absolutely do. Now, some of them were written a little ambiguous, and I wasn't really sure exactly what you were asking me with this, but I will let you know that air ambulance is not exempt, nor is any ambulance exempt from secondary payer. As a matter of fact, depending on liability, no fault, those two play in even more sometimes, especially for rotary and where are you picking them up. Was it an accident? Was it a car accident? So when you're saying scene of an accident, you may have to give us some more information. Employer group health plans or group health plans in general, which are employer-based plans, will always be primary. So that's kind of just a reminder about that information. If you have questions on that, I really do recommend throwing that back into chat. Let's chat more about it, but let me get those specific questions versus that kind of generalized one. This was an interesting question too that led me to put the state licensure slide in there. They had an air ambulance that was hangared in one location, but was not state licensed, but transported across a state line. So they were not state licensed in the origin state for the transport, but they were in the destination state. So yes, you do have to have a current state license. When you go to bill it, it's always going to be based on your hangar location. That's who gets the bill for Medicare, your Medicare administrative contractor. But your starting place of pickup and your destination place of drop off, you still have to be licensed to practice within those states. There's nothing that says, hey, you can just kind of go wherever you want and do whatever you want. You have to meet those requirements. Um, I do have a great expert on enrollment on this call, so I will ask Leanne in just a moment to add in some input if she has anything from a provider enrollment standpoint for state license. But I do want to remind everyone that Medicare uses the state license to determine your level of care and whether or not you meet every ambulance requirement that they need for the state, which would mean that you meet the ambulance either fixed or rotary wing. They can look at your professionals involved and require those licensing. So there's a variety of different factors. Leanne, do you have anything that you would like to offer on ambulance state license for air?
The one thing with that is they will be looking for information regarding the FAA certifications and information about where that air ambulance is housed, if it's housed, say, at an airport. But otherwise, what Tom's saying is absolutely correct. We are looking at those state licensure, and it will indicate that you've met those requirements for enrollment.
Thanks, Leanne. So again, I'm not really sure where you're going with your question. I'm hoping you were not trying to tell us that you had an expired license that you didn't have updated in time, because that would mean any transport provided during that time isn't covered because you don't have a current state license. So if you don't want to say that out loud, if you don't want to put that back in the chat, that's okay. I just wanted to put that out there. I was hoping that was not where you were going with it. So yes, it is your responsibility also to make sure we do keep those current state licenses. You do want to update those with us so that we do have a copy if needed, or at least the license number if needed. Okay. That is the basics of the basic stuff that we went through. Again, I did kind of keep it pretty basic. And I did that on purpose, but I tried to relate it back to the questions that you guys are answering. So I'm going to keep going through, but I really am going to move on to the air requirements for the next section. I will tell you, I did have more on fixed than rotary. So some of my answers may seem a little off to you, especially if you only do helicopter or rotary ring and you don't do fixed. So I want to make sure that you're well aware of kind of where I'm coming from. But at any given time, please put that information back into the chat and we'll get you what you need from there. Okay, so the patient's condition. So yes, you do need to assess the patient's condition. And yes, this should be done when you first pick them up. This is why in many cases, the air in the point of a site of transfer is actually with the ground crew at that time. If not, you can stay at the airport, but you do have to do an assessment when they arrive there and whether or not that's medically necessary. Keep in mind, they're going to explain why this is needed based on the physician certification statement, based on what they've observed as a ground crew for the fixed wing before they got there, all of those types of things. And, this is just my picture or my example of it. So really, when we look at that assessment, it's who's treating the patient and why are they treating the patient today, but then go a step further. Why are they needed? Why are they needed? That does then explain, hopefully, will justify why the air is needed. So we want to look at that, and we also want to make it clear they could not go by ground because sometimes the answer is, yes, we understand it took longer, but the patients would be at greater risk if we transferred them by ground, even though it took us longer to get the air dispatched, such as a fixed wing where they have to get the crew, then get it to the airport, take it to the patient, and all of those different things. So you really need to justify that. What is the patient's condition and why is it contributing to what's happening right now, today, at this moment, that makes your air, whether it is rotary or fixed, the only safe means of transport? Okay. The question that came in is, does a doctor's order make it medically necessary? And the answer is no. Okay. Let me give you an example of this. One of the documentation examples showed that an air transport to a further facility for medical necessity care not available at the critical access hospital. Okay, so it's a critical access hospital, which is a small community hospital. They're taking it, the example shows that they need to go to a bigger trauma center. That makes sense. Medically necessary, yes. The doctor ordered it by air. Okay. However, when we looked at it total by air and there was no justification for this, the time that it took for them to get the helicopter to the critical access hospital, to load the patient, fly them back to the center, unload them, and get them back into treatment was much longer than if they had just loaded them in the ambulance, the ground ambulance, and driven them. So based on that, we were like, okay, why do they need to go by air with all this time and advice and things like that? And the answer was we couldn't find anything. Now, we're not saying that they didn't need to. What we're saying is within the documentation, it wasn't there to show us that the patient's condition required that air. And that was a common factor, which led me to build in the next slide as well based on that scenario. And we just want to talk a little bit more about time. So one of the specific things that goes with an air transport is time. How long will it take air versus ground, and why is that critical? But also total time is taken into account. Total time means from the point that you're looking at, could I just dispatch a ground ambulance to pick them up, drive them, and then they're dropped off and they're done, versus how long does it take me to prep the air ambulance, get it there, get the patient to the air ambulance. All of that plays into a factor. So it's time to get the air ambulance to the patient, along with the time to get the patient to the air ambulance, and then explaining why that's also the safest means. One of the biggest factors that we have seen come into play when it comes to time is the patient's wait time. How long will that patient sit at a facility? But again, we're not saying it's not medically necessary for them to go by air. It's actually the opposite. We're saying just tell us why. One of the other factors that plays into it is if you're taking them by ground somewhere, why couldn't they go the full trip by ground? So if you're taking them from a hospital to a fixed wing, and that's a 20-minute drive, why couldn't they have gone the full round trip to the other higher level of facility? Why did they need that air? Where again, I'm not telling you it's definitely not something we're not going to cover. It's definitely something we're going to cover. The basis of coverage really has to be explained well when it comes to time. The scenario that was given to me that also led me to put time in here, they did a air transport, and it was a fixed wing transport. And the reason they did it was because there was severe storms and it made it unsafe for the patient to travel by ground through the storms to the nearest facility. So they actually had to go to a further facility, but by the time they drove to that further facility, it was a long time, and it was a big long explanation. Yes, that is a consideration. Weather and the patient's safety is a consideration. However, you do need to document it. This particular ambulance company did a phenomenal job of documenting it and actually was paid to use the rotary wing to get them there, or I'm sorry, the fixed wing to get them there because of that. Okay. So we really are looking at that. A couple of other things that were mentioned, would we consider things like roadblock or road outages, construction, time of day? Yes, yes, and yes. We just want to know what's going on. And so when someone said like time of day, give you an example. Where I live, there are certain times traffic will back up. I live in a large metropolitan area. Our two main trauma centers are downtown. Yes, we do have smaller locations outside of downtown, but they're not the ones with all the specialized care. Okay. Now they can do some different care, but if you need to get to someone downtown, imagine if it is 4:30 to 5, probably closer to 6:30 in the afternoon. What's happening in that downtown? It doesn't matter if you're going north or south from where I live. All the interstates are backed up. All the roads are backed up. Everyone's leaving downtown from those big buildings. Time becomes a contributing factor. It may be better to load them into that rotary or that fixed wing or whatever the situation is. May also be better to take them to a different location. So yes, all of those need to be explained. So hopefully that does make it a little bit easier for you. But please remember that a physician certification statement can definitely help you assess time. Maybe they contacted this facility, and to get the patient there, it's going to be this. That's why they're actually choosing to dispatch them via air. Okay, well, tell us that. that's fine. So the physician certification statement can also help support time. The next slide is just some procedure code stuff. And this was an interesting question that we got because one of the primary payers had wanted everything broke out. They don't necessarily just want a base rate. They wanted things like supplies and other things like that. For Medicare, we do only recognize base rates and mileage as payable. That's what you get. Now, keep in mind when we say that, everything rolls into them for us. If a different payer needs it billed differently, that's fine. Bill it however that payer needs. Add a medical record note as to why you're doing what you're doing and why you're merging things together for us. Okay. We do make an assumption, and that assumption is that it is an emergency condition. Now, keep in mind that does not mean that there isn't post-payment review on these, and post-payment review could find something completely different. So as your Medicare administrative contractor who actually pays the claims, we assume you are sending us a claim that is medically necessary. We assume that your medical records will support each one of that. Now you hear me keep saying the word assume. Well, if we weren't making that assumption, you would have to send in your medical records for every air ambulance transport. We didn't find that to be something that was useful. We have done those types of reviews in the past. So instead we make that assumption, and then if it gets caught on post-payment review, it will be taken back. Okay. So again, we need to know why it's emergent, what the urgent nature is, should we make this into an emergency claim? Okay. Your records need to support that. One of the questions that was brought to us was, what is the revenue code? This must be, I'm going to assume that you are a ambulance-based biller. Your revenue code, only revenue code recognized by Medicare is 540. Now you do have to have on that same line item with the UB04 or 837I claims, revenue code 540 plus you do have to have your base rate and mileage. So we have two separate lines, one with base rate, one with mileage. Each one must contain your origin and destination modifiers. Please make sure that's there, okay? So we really are looking to verify that this doesn't bundle into another service and there aren't other things that go on with that. Someone did ask me, why would it bundle into another service? If a transport occurs during an inpatient stay, it will bundle into an inpatient stay. Sometimes this occurs and later there's another bill sent in to say, hold up, this inpatient stay was really over, but the discharge hadn't come in yet. So the air ambulance looked like it was done during the inpatient stay. If that happens, you may need to do a rebill or an appeal after the fact. Our systems are not smart enough to gather that that has changed. It will say, hey, today this is what happened. Okay. So I wanted to make you aware of that. And in that case, when you bill on the UB04, the 837I, and you do use revenue code 540, it's automatically going to reject for inpatient stay. Well, you're not doing anything wrong. We just don't have the end of the inpatient stay on file. So hopefully all of that put together helps answer the couple of questions we got from the particular facility billers on that. Ambulance modifiers are required. We've talked about this. The origin and destination are absolutely required, and you do have to use a Medicare recognized origin and destination code. For origin, make it fit. Use the best code that best describes it. For destination, if it is not described by one of those codes, it is not a Medicare covered destination and therefore should not be used. But you also have to use the best destination code you can. That's why a site of transfer is so important. That's why for fixed wing, site of transfer is so important. We want to make sure that everything lines up. For facility-based, again, that's the UB04 or the 837I. I do need to know the QM or the QN on everything. You could also put the multiple patient GM if need be, and then we will divide up certain portions of it depending on what's going on with that patient, and that's the mileage. Again, origin and destination codes are important to make sure that we know what is going on with that patient. Just trying to make sure I didn't miss anything based on those questions. questions? Okay, I did not. The next section is other questions that we got in that I haven't answered yet because I really didn't fit in so far. So we're going to go through some of those before we hit the live questions. But I do want to remind you that if you have live questions, now is a great opportunity to get those into chat. The first question we actually got is about the advanced beneficiary notice of non-coverage, and it's when do you need to present the ABN? Anytime you believe that the air transport is medically necessary at a ground level of transport. It will not be medically necessary at the air level, but it will be medically necessary at a ground level. And I've given you a couple of different scenarios with that based on the scenarios that you gave. It could be perfectly necessary for a person to leave a critical access hospital and to go to a larger hospital that has different facilities, or even sometimes one of the larger trauma centers, but they don't have a certain type that day, or they can't treat this patient that day. That's all fine. But if they could have safely gone by ground, either due to time, due to any other circumstance, the ground would have sufficed. The air ambulance crew can give the patient an advanced beneficiary notice of non-coverage. What they're going to do is just explain, hey, this transport isn't medically necessary at the air level. You could safely go by ground. Our assessment justifies that. And then you want to make sure that you bill that accordingly. So that's what we're looking at when we're looking at the advanced beneficiary notice of non-coverage. Again, it has to be medically necessary. Along with that, so they asked for just a review of the ABN modifiers. So I put this slide in, thought it might be helpful. There are two ABN modifiers and two modifiers on here that aren't related to ABN but are commonly asked about with the ABN. So the first one is the GA, and this is the ABN given and signed for the not medically necessary level of care. Transport is medically necessary, but the level of care is not. And this would be where we described where they could safely have gone by ground, but for whatever reason they need to go by air. Some patients will insist they need to go because their doctor said so. Doesn't make it medically necessary in Medicare's realm. Okay, that's when you would give a GA. GX, an ABN is given, but it's not required. These are the transports when it's not even medically necessary, when it doesn't meet that Social Security Act Section 1861 S7. So that's what we're talking about there. It's not part of the Medicare ambulance benefit. The GA says they did meet Social Security Act 1861 S7, but they did not meet Social Security Act 1862 A1A, which is the medical necessity section for that level of care. Then there's GY, which says it didn't meet the it didn't meet section 1861 S7. So in other words, it's not covered because it's not medically necessary. Hey, by the way, I didn't give an ABN. That's fine. You don't have to give an ABN. So in that situation, you don't need to give an ABN. We're not going to do anything to you. You're just going to put GY on there and indicate this is the patient liability. A lot of people have asked why that would want to be billed in that manner. And our answer to you is because the patient asked you to. That's what we're looking for there. Why are you billing it? The patient asked you to. It's not medically necessary, but once they ask you to bill it, you do have to bill it accordingly. And then the GZ modifier says, oops, I should have given an ABN and I didn't. So don't hold the patient liable for the difference because I didn't tell them. It's now my difference and I have to write it off as the provider. So in other words, they could safely have gone by ground. They went by air. We didn't tell the patient that we feel they could safely have gone by ground. So therefore I get the liability. Someone asked why you would want to bill any of these or why the ABN is required. And the basic gist of it is to allow the patient to do an appeal. So while you can't appeal something that is a GY, you can tell us to remove it and say it's covered, it is medically necessary, but you can't appeal that. We're not going to review that. It either is or it isn't. And the GY modifier is what is used to indicate that. The patient, on the other hand, can ask for us to review that. They will be given appeal rights, which means you may receive on any of these, you may receive a request for medical records. And we're looking for the run or the trip sheets. The reason that we're looking for those is because the patient asks us to medically review it. And they can do that on any service. They can also say, I don't like how much they were paid for this. We have to do a review of that. So there's a variety of factors that play into it as soon as the patient gets involved, but you want to make sure you're billing correctly. Another question that came in related to these modifiers and the ABN is they gave an ABN. They did not feel it was medically necessary for the patient to go by rotary wing to this facility. They felt they could have gone by ground. They did bill correctly with the GA. They then filed what they felt was an appeal on the patient's behalf. Now, the reason I say what they felt is because there are very specific requirements that need to be met. One of them is that the patient needs to sign and date a form allowing you to act on their behalf. There's an appointment of representative form, or there is additional information that can be given. If you don't do that, you are not filing on the patient's behalf. You're actually filing on your own behalf. So when it came back to this one, we simply removed the modifier and processed it as if it was a medically necessary full transport, which was actually not the intent of the provider. It then later got reviewed by one of the review entities and found to be not medically necessary. They instructed us to take the full payment back. The provider said, but we already told you this. Well, the miscommunication came in the appeal situation where they didn't actually incorporate the information to make it a patient appeal, where they were appealing it on the patient's behalf. So that became a much longer scenario given when we actually incorporated all of the question for the ABN into that and all of the different pieces of information that went with it. So I apologize for that, but hopefully I got the whole thing answered for you. If not, let's feel free to put that back in the question and answer section, because here we go. What are you looking for? Help me out with the live question answers. What do you guys want to hear? Leanne, do we have anything?
Tom, we do not have any questions in the chat.
All right. Well, thanks everybody for letting me off easy on that one. But again, I'll give you another opportunity, just a few moments. I'm going to go through some closing slides. All right. You will get an automated email unless you called in. If you called in, I will need you to email us, and I'll tell you how to do that in just a moment. The automated email will contain a link to the survey. That's the upper box, says survey. The lower box is around the certificate of achievement. We do not offer continuing education units. That's through your governing body. A lot of times it's NAC, but it might not be. What they look to us to give you is a certificate that contains our contact hours. If you are on and you registered and signed in with your email, you will get that information. I don't need to do anything. The system sends it out in an email. Awesome, we're good. If you did not and you called in and you do need that, then you do need to do something. And what that something is to send us a request. This would also go with your follow-up questions. So for the next 7 days, I will take follow-up questions from this information. You will email them. It's wps.gha.education@wpsic.com. Incorporate today's topic. What is today's topic? Air ambulance. Please don't put today's topic. That's not in quotes. That's not anything like that. I want you to put air ambulance. If you put air ambulance in there, you can ask a question. You can give me follow-up information. If there's something that I was unclear with, feel free to add any of that. If you need a certificate, you can put, I need a certificate. We will generate one manually for you. But part of that manual process is that we have to verify that you called in, which means I need a phone number with area code to do that. So lots of key pieces there, depending on what you need from me. Basically, if you just need, if you just have a question, go ahead, just put today's topic, follow that up. If you do need a certificate, again, put today's topic, air ambulance, follow that up in the body, just saying, hey, I need a certificate, I attended, and here's my phone number with area code. We're perfect, we can verify, and we'll move forward with that. All right, next slide. We always want to hear what you have to say, especially when we do something where we focus so much on the questions and answers, and we build a presentation based around those questions and answers. Some people love it, and some people are like, oh, we feel like you missed this or you didn't give us this. So we really wanted to spend the time to take that feedback back in and to see how we did. When I say I want your feedback, I'm going to ask you a couple of different times, and you've already seen one opportunity in the follow-up email that's going to come out to you. Take that survey. If not, I'm going to have Leanne put a survey link directly into the chat. You can use that right now today. Last, I will give you a redirect. It looks like the bottom box there on the bottom. And the redirect is just something that you can click on and say continue. It's not malicious. It's not any kind of, phishing, any kind of thing you've heard bad things about. It is us asking you to take the survey. It does go to CMS. It's pretty important that you have that. I also want to tell you that if you have a follow-up, if you have a colleague listening to the encore, any of those types of things, we're going to give you an online survey also for that. So you can do that. On the left side, you'll see it says survey, online survey. It's got a picture with a hand pointing. That is going to be the link that you'll use. If you select that picture in the encore, it'll actually open the survey for you. So it'll give you a lot of opportunities to take the survey. It's very important. As a reminder, please do incorporate any information you want in there. Please don't say ambulance education. That is too general for me to really do anything with. If it is physician certification, tell me that. If it is ground ambulance, if it is site of transfer information, help me understand what you're looking for. The question and answer sessions are great when I get them. Obviously, this one was pretty comprehensive because we were able to build a full 1 hour presentation basically off of your question and answers. That's what we're looking for when we look for those types of information. Okay. That brings us to the end, but before I do my final closing comments, I just want to see if there are any questions that were submitted in chat. Leanne, did we have anything come in?
We did not.
All right, perfect. Well, thanks for attending, everybody. We appreciate you taking the time out of your busy day to fit us in and to listen to our message on Air Ambulance. Please remember to take that survey. Just, tell us the good, the bad, and the ugly. What did I do well? What could I improve on? Did you like my presentation? Did you like the resource that I showed you? Any of those types of things. Please remember to include any future education you'd like to see or whatever you're looking for in that manner. It's important to make sure that we do have all of that to help you out. So on behalf of myself, on behalf of Leanne and all of Provider Outreach Education, we thank you for participating. We do look forward to your survey comments. We hope that you'll join us again in the future for more education. You may now disconnect. Thank you, everybody, and have a great day.